Speaking of Twitter,
him a lot.
The comments about his suit filled my inbox.
Maybe he could wear a darker suit next time.
No, it's dark. It's that Chicago Al Capone pinstripes.
That's okay.
Gangsta pinstripes. They're cool.
He was great.
He's very British. I liked it.
We'll get Scott Simon back with us
now. You know
now.
who else is a great dresser?
Who's a great dresser?
Gavin.
Gavin. He's so cool.
Do you think he could teach me to dress?
No one can.
No,
not even Gavin Newsom, the mayor of San Francisco. Thank you, Mr. Mayor, for coming on the show this morning.
Mr. Mayor, I understand you've got universal health care in San Francisco. Tell us about it.
Yes. Yeah, the only city in the United States of America that's doing universal health care. We're not asserting it. We're not talking about it. Over 60% of those that were previously uninsured a year ago are enrolled in our Healthy San Francisco program. About 600 to 700 people every single week are enrolling in our program. Regardless of pre-existing conditions, people are able to get a medical home and a medical card, public-private choice, no new bureaucracy, no new tax increases of significance that were created. We think it's a model program for the rest of the country.
Hey, Gavin, it's Nancy. You know, obviously I know San Francisco well and I've known you for years. Explain to everyone how important San Francisco General is to health of San Francisco and how you have re-energized the neighborhood clinics, which are really the backbone of people getting reasonable access and good health care.
Well, Nancy, you just answered the question you guys were just asking. I didn't answer it very effectively. How are we doing it? Well, it's exactly how we're doing it. We're actually engaging our community clinics. We have 27 community clinics participating in our Healthy San Francisco program. 13 of them are public, 14 private, so there's a real choice. But it's all about cultural competency. It's about delivering community-based services in our unique and diverse neighborhoods and building capacity, also into institutions like San Francisco General Hospital. We've also, though, engaged the private sector in Sutter and Catholic Healthcare West. Some of the largest medical institutions in the United States are also participatory in our program. So it's a true public-private. It's something that I don't think can be done elsewhere. I know it can be done elsewhere. If we can do it, it could be shared across not only the state of California, the rest of the nation.
Because if you look down south, Los Angeles has had its clinics gutted, and it's really, it's teetering. But at the end of the day, can you explain to us easily and simply, in ways that we can all understand, how you figure out where the money goes, who gets what, and how can you afford this when other cities say that they can't?
Well, Nancy, the big idea for us was this. We were asking the wrong question, and I'm not suggesting the president's asking the wrong question, but locally we were. We were saying, how do we provide universal health insurance to all of the uninsured? That was the wrong question because we simply couldn't pay for it. So we asked a different question, profoundly different. How do we provide universal health care to all of the uninsured? And as a consequence of that, we have a universal health care strategy. And the way we're paying for it is easy. We were already paying for it, and everybody knows that. We were paying for it in the emergency rooms. We were paying for it in terms of uncompensated care in our community clinics. Now we actually have the patients following the money. We have these partnerships that have been able to allow us to draw down dollars from the private sector and from state and federal sources. And as a consequence, our program is all but paying for itself. Remarkably, in the first couple of years, no new additional general fund cost to the taxpayers of San Francisco. $73.1 million of federal money that was drawn down in the first year because we came up with a different idea. And so the money's out there. Don't let money become the excuse. We're already spending way too much on health care, but we're not spending it wisely.
Carlos Watson.
Mr. Mayor, Proposition 8, the ban on same-sex marriage that voters approved in California last year, as you know, will be in front of the California Supreme Court today. What do you think is going to happen, A, and B, if the court ultimately upholds the ban on same-sex marriage, what's the next step for those who oppose Proposition 8?
Yeah, great question. Here's the question the court's going to be asked. Whether you agree on marriage equality or not is really not the question in front of the court. It's a constitutional question. Was Prop 8 valid because it was simply an amendment to the Constitution, or did Prop 8 require a revision to the Constitution? And here's the distinction. A revision, a major change to the California Constitution, requires 2/3 of the legislature to make the determination of whether or not that goes in front of the voters. An amendment does not. It requires just a simple majority. This was an amendment. And the question is, taking away someone's fundamental rights of a protected class, taking away the rights of any minority, be it based on sexual orientation, for that matter, gender, is it a simple majority that you need to do that? In this case, that's what Prop 8 did. Our argument is, boy, that's a revision. That's not a simple, modest change. That's a fundamental change. There's also in balance 18,000 couples that are wondering if their marriage licenses are still valid. And so that will be determined after the court's decision within 90 days. Then the next step will be perhaps to go back in front of the voters.
Mr. Mayor, it's Willie Geist here. I want to ask you a question that's been on the minds of many people. Will you, in fact, be running for governor in the state of California? And what kind of task would that be if you did?
Break the story right here on
Right here, let's have it.
This is
Come on,
exciting.
Gavin.
Break the story here.
Hold on.
Come on, Gavin.
All right, go ahead.
We're listening.
Well, first and foremost, I've taken out I hate those politicians can never answer.
Gavin, don't do
He's going to say exploratory thing. Let's
don't
listen.
do one of those special answers.
I want to thank you for the question. I look forward to having a comprehensive debate on the topic.
Hey, Gavin, could you do this? I have taken out. Yeah, do all that. Politicians.
Yeah.
He's great at this.
Well, first, I thank you for the opportunity to discuss this morning. It's a great honor. The people of California are fine people.
Yes.
I know. I know what I appear like. Look, bottom line is I actually have done a legitimate exploratory committee. I'm not naive. Look, you know I've been involved in controversial issues. Prop 8 is just one of many controversial issues. San Francisco values. So I really want to get a sense from the rest of the state. I don't want to make this an errant effort. I don't want to waste people's time or resources. This is an expensive race. So I've been doing town halls up and down the state. Was just in Placer County. Nancy, you know Placer County.
I do.
One of the reddest counties in America, not just California. And I'll tell you what, no one brought up the issue of marriage equality. We're talking about health care and education, the environment, and issues of the economy. And that's given me some solace that in the next 60 to 90 days, I'll make a decision.
You know,
Gavin's honest.
Is that an answer?
He's in. No, this guy's serious.
That wasn't yes or no.
No, this guy's smart because he has set up, as he said, a legitimate exploratory committee. I made the mistake when I was thinking about running statewide of setting up an illegitimate exploratory committee. The headlines were horrific. Go ahead.
Gavin, what does a Gavin Newsom, Meg Whitman race look like?
Good question. Good question.
It looks very expensive. She can self-finance. Man.
The governor's race in California will be the best race next year in all the country.
I think it might be.
Jerry Brown, Villaraigosa,
Jerry Brown
Mayor
is not
Newsom.
anything.
You don't think Jerry Brown's going to jump in the primary?
It's Whitman and Newsom all the way.
Really?
You heard an endorsement. You mean he may not have announced, but you heard an endorsement.
It's Whitman and Newsom, and then it's going to be expensive.
Yeah. I appreciate your candor. I hate those pat answers that people give, like, I love the job I'm doing right now. My worry is the state of New York.
It's going to be a big
I hate those pat answers that people give, like, I love the job I'm doing right now. My worry is the state of New York.
It's going to be a big race.
The job I'm doing right now. My worry is the state of New York.
It's going to be a big
It's not over until the lady in the pantsuit says it is.